So we have Medicare for the over 65s, we have Child Health Plus for the under 18, that's the in-between group that is left out, and we have some family health for people in the in-between group if they happen to be parents of children on Child Health Plus. Then Native Americans, under a treaty from way back, have their insurance paid if they're on the reservation. If they move to the city, they go off of it. They don't get it anymore. But Indians who live on reservations have health care such as it is. It isn't always terrific. Then there's the Veterans Administration, which is paid for by the government. And then there's military. All the military take care of their own. And all of those things are public, paid for by out of our taxes or out of Social Security or whatever the arrangement happens to be. The Lewin group plan, Colorado wanted to have a new health plan, and so they had a study done, and they asked this research group, which is a nonpartisan research group that's not biased either way, and they took 4 different possibilities, and they studied them. And the first one was called Better Health Care for, this is the summary, the actual thing's about 30, 40 pages long. You download it from your system. And they looked at this one, which offers public-private, and said, there are now this many uninsured. When you finish with this, you'll cut it from 47 million to, or whatever their number was, down to this, and you'll spend $595 million more than you're spending now. Then they took Solutions for a Healthy Colorado, the second plan, which was a private sector plan, plus Medicaid and Child Health Plus, and said you'll cut the number of uninsured down to 133,000, and it'll cost you 271 million more. Then they took a plan for covering Colorado, and when they got through, the only one that saved them money and got everybody covered, so there'd be no uninsured, was the single payer one. And that's back there. That's called the Lewin Group, and they did a study for Colorado. So I'll start by saying the non-system that we have right now is a combination of public health care, health insurance, and private health insurance. And it runs about 51% public and about 49% private if you start counting everything. And I have a little thing here I was going to draw on the board. And the right-hand side, the red, the orange, and the sort of whatever other color that's on the red side, this is public. And the blues over here are the private. The top one, the red one, represents Medicare, which is for all people over 65 and includes some disabled people and people that get dialysis who may be under 65. And the second one, the yellow one, is Medicaid plus CHIP. CHIP is the Child Health Insurance Program, which in New York State is called Child Health Plus, because we started it before the national government did it. Of course, as you know, Bush has vetoed the bill to continue it twice now, and they don't have enough votes to override it. They need 60, they don't have 60. The third one, the sort of orangey one, at the bottom, which is still public, represents all the other groups, the veterans, the military, the Indian Health Service, now called Native Americans. They're in a treaty that allows them to be paid for, and anything that the states or local government do by way of subsidies. Okay, now the blue side is the private side. And the first one at the top, well, let's start at the bottom. The big real blue one, 36%, that are all the private health insurances, by whatever name. There are lots and lots of them. I think there are 1,500 of them throughout the United States, and each one has about 10 different levels of insurance that you can buy. So if you start multiplying that, you know how many people they have to just to keep the records. I'll give you one example. In Canada, Toronto General Hospital, which is about the size of, say, North Shore Hospital in Manhasset, they have 3 people doing medical records. North Shore the same thing. So we're paying for 297 extra people's salaries just to keep the record. You can't put it on a computer because every form is different, has the date at a different place. There's no way you can standardize it because nobody will standardize. So that's one thing. The lighter blue, the top, 14%, which is this slice up here, is the out-of-pocket payments that people make, co-payments, deductibles, healthcare premiums that you pay, everything that a person has to pay out of pocket. And that's 14% of all the expenditures on health. And the little 5%, sort of almost white or gray down here at the bottom, is what charities spend to help people that need help. So it's all the private spending by private organizations, and social service organizations like the Long Island Council of Churches, which helps people with various things when they need it, and Catholic charities and Jewish Appeal have a group, Maison, all of them. So that 5% represents the charities of the non-profit private organizations. So you can see that it divides pretty much in half, which gives us a very impossible, mixed up non-system for healthcare.
What specifically can we as individuals and the organizations with which we're involved do to do something on this?
You could join a single-payer organization once in a while, go into the city for the big meetings, but be part of it, and so you get their emails. Like I get 3 or 4 emails a day. I get one from Albany every single day from Dunley of the Hunger Action Network of New York State. And he's lobbying every day in the legislature, and he sends us emails every day. I get them from New York City. I get them from Washington, D.C. So that keeps me up to date on what's going on. You can get on their email list even if you can't get to meetings. You don't have to be where the thing happens on email. It can come to you. You can try to write to and bug your legislators. You could bug whoever your legislator is to sign on to the communist bill. Get a group of you and go and make sure that some of you are in his district. Because if you go and none of you are in the district, they won't listen to you. But if you were living in the district of, say, Tim Bishop out in Suffolk County, and you had some other people, and you went 4 or 5 and got a date with him and went and said, this is what we want. Why aren't you signing on? This would have this value, this value, this value. You can write to Newsday. You can write even more to your local, these weekly newspapers that are on the chain that everybody has. They're always looking for stuff to print. It's easier to get stuff in those. You can have sicko showings in your house, invite people to come to your house and show the sicko DVD, which is now available. But you can get it not only from the library, but you can get it from the public Physicians for National Health Plan. Moore gave them a whole pile of them so they could use them. And he's made it available to the single-payer groups. He wants them. Yes. Michael Moore provided the DVDs to all these organizations with the hope that they would start showing it around in smaller groups.
I mean, 70% of the people want that.
You have to demonstrate.
I know.
We have to demonstrate.
But you have to recognize that there are 435 representatives in Congress. There are 800 lobbyists for health care insurance, 2 for each one congressman, who are paying them out money, who are paying for their golf membership, who are taking them out to dinner, who are giving them a free trip to Cancun for a vacation, paying their, doing all those things. How are you going to get a big risk pool with public-private? Big enough risk pool to lower the costs.